Hello, my name is Sam Smith and I'm the Clinical Nurse Advisor and Senior Territory Business Manager for Flen Health. I am a registered nurse and before joining Flen Health in 2020, I was working as a Tissue Viability Specialist nurse in an acute hospital. I still hold an honorary contract as a Tissue Viability Nurse in an acute hospital, keeping up to date with my clinical practice. I am here today to talk to you about the lower limb recommendations for care for red flags. The National Wound Care Strategy Programme 2020 for lower limb ulcers recommend that any person with one or more wounds below the knee should seek immediate and necessary care. A leg wound is defined as originating on or above the malleolus, the ankle bone, but below the knee, and a foot wound as origin below the malleolus, the ankle bone. The National Wound Care Strategy Programme highlights that red flags are as followed. An acute infection of the leg or foot, for example, increased redness, swelling, pain, pus, and heat. Symptoms of sepsis, an acute or chronic limb-threatening ischemia, suspected acute deep vein thrombosis, DVT, suspected skin cancer. We must treat suspected infections in line with NICE antimicrobial guidelines and local policies. We must immediately escalate to the relevant clinical specialists. For people in the last few weeks of their life, seek input from their other clinicians to agree appropriate care plan, taking in a full holistic assessment. When red flags are highlighted, then immediate care should be followed. This will include wound bed cleansing and emollients as required, applying a simple low adhesive dressing with sufficient absorbency. For leg wounds, first line mild graduated compression. When appropriate, people with leg and foot wounds should be supported to self-care. When a patient is in hospital, then an assessment times for diagnosis and treatment must be followed. The patient should be referred to the diabetic foot wound, MDT, within 24 hours if they have a diabetic foot wound. Any other type of foot wound and a referral to an MDT should be made within 1 working day. A patient with a leg wound should have assessment within 14 days. I hope you find this podcast helpful. Thank you.